Hey everyone, welcome back for our next session. We're going to hear a little bit about drug pricing reform from Christy Martin, so it's my pleasure to introduce her now. Christy Martin is the Chief of Staff and Senior Advisor to the Deputy Administrator in the Center for Medicare. As a policy strategist, she draws on her decades of experience working in the public sector with private sector clients and in philanthropy. She was previously the Vice President for Healthcare at Arnold Ventures, where she led the philanthropy's prescription drug pricing portfolio and was the Managing Director of Waxman Strategies Health Practice, where she worked alongside Congressman Henry Waxman, driving toward progressive outcomes in health policy. Christy served several years in the U.S. Department of Health and Human Services, Office of Personnel Management, and Government Accountability Office. We're really excited that you're here with us today to share, and I will kick it over to you. Thanks so much.
Thanks, Sydney. I'm thrilled to be with you all today and really appreciate the Senator hosting this wonderful event. I'm going to talk to you a little bit today about the changes to Medicare as a result of the Inflation Reduction Act. The Inflation Reduction Act provides meaningful financial relief for millions of people with Medicare by improving access to affordable treatments and strengthening the Medicare program, both now and in the long run. The new drug law makes improvements to Medicare that will expand benefits, lower drug costs, keep prescription drug premiums stable for Medicare beneficiaries, and improve the strength of the Medicare program overall. There are several changes as a result of the Inflation Reduction Act, and I'll go into a little bit more deeper dive on some of these. For example, in the Part D program, or the prescription drug program in Medicare, there's changes that for people with Medicare will benefit from lower prescription drug costs and a redesigned prescription drug program. These benefits include providing insulin at a copay cap at $35 a month per prescription, which started in January, access to recommended adult vaccines without cost sharing, which also started this January, and I'll go into a little bit more detail on these. A yearly cap of $2,000 starting in 2025 on out-of-pocket prescription drug costs in Medicare Part D, and expansion of the low-income subsidy program, sometimes called LIS or Extra Help, under the Part D program up to 150% of the federal poverty level starting in 2024. In addition, the law makes changes to allow Medicare to negotiate drug prices directly. Medicare will be able to negotiate with manufacturers to lower the price of some of the costliest single-source brand name Medicare Part B and D drugs. This means that people with Medicare will have increased access to innovative life-saving treatments, and the cost will be lower for both them and Medicare. There are also changes with the new law that requires drug companies that raise their drug prices faster than the rate of inflation to pay Medicare a rebate on those drug increases. This will lead to a stronger Medicare for current and future enrollees and discourage price increases that exceed inflation from drug companies. And finally, there's some changes that affect the Part B program in Medicare or outpatient services and physician-administered drugs. Changes in the Medicare Part B program will improve access to high-quality, affordable biosimilars for people with Medicare, as well as impose a $35 per month cost-sharing cap on insulin used in the durable medical equipment program. These also apply to people who have Medicare Advantage. The Inflation Reduction Act makes Medicare stronger for current and future beneficiaries, makes healthcare more accessible, equitable, and affordable by lowering what Medicare spends for prescription drugs and limiting increases in prices. We'll turn now and give you a little bit of an update on where we are on implementation of some of these exciting new changes to Medicare. We are on track to meet our deadlines. On October 1st of last year, we implemented the temporary payment increase for qualifying biosimilars for 5 years under the Medicare Part B program. This is to encourage price competition in the Medicare program for lower cost, high quality biosimilars. We're also excited that on January 1, we had 2 provisions go into effect. The first was the Part D insulin provision, which meant that people no longer have to pay more than $35 a month per covered insulin in the Part D program. So capping their benefits or capping their cost at $35, already delivering savings for millions of people with Medicare. Another related provision was that we were capping and removing from the deductible vaccines. So recommended vaccines are now available through the Part D program without any cost sharing. And those went into effect on January 1st. The provision that makes adult vaccines recommended by the Advisory Committee on Immunization Practices, such as the shingles vaccine, available at no cost to individuals with Part D coverage, and we're very excited to be announcing that. In January, we released a memo and a timeline on our approach to implementing the Medicare drug price negotiation program for the first round of negotiations. We recognized early on that we cannot implement this program alone and that public input is critical to our successful implementation. Through the memo and timeline, which is available on cms.gov, we let the public know when and how they can make their voices heard on this important endeavor, and we feel like it is very important to give stakeholders the detail and predictability they need so that they can contribute to our implementation efforts. In February, we also issued program instruction on implementing the inflation rebates program in Medicare. This is the provision that requires that drug companies pay Medicare a rebate if they increase their prices faster than inflation for certain Part B and Part D drugs. We're intending to invoice manufacturers for the first rebates they owe in 2024, and we believe this provision will help to hold costs down by discouraging drug companies from increasing their prices faster than inflation. And just last week, we made a number of announcements on Wednesday that help to show that we are staying on track to implement in a timely manner. The new drug law, as I mentioned, provides Medicare the authority to directly negotiate drug prices. This is a first for the Medicare program. By considering such factors as clinical benefit and unmet need, negotiation tends to increase access to life-saving treatments for people with Medicare. It is a powerful tool that, in addition to improving access and affordability, will drive companies to innovate, to stay competitive, foster the development of new treatments, and deliver on methods for companies to develop cures for people when they need them. This is top of mind as we foster a negotiation process that encourages and supports innovation while strengthening the program now and in the future. We were very excited to announce last week that we issued program guidance with a 30-day comment period outlining how we will approach implementation on this first round of negotiations, which will culminate in September 1, announcing the first 10 drugs in the Part D program that will be selected for the negotiation program, and October 1 will kick off the negotiations with prices going into effect in January 1, 2026. We're thrilled to be implementing all these changes and committed to having robust stakeholder input, feedback, and engagement, as well as transparency as we go through this process. With that, I'm happy to take any questions.
All right, thank you so much. I really appreciate that. Our webinar does not allow for live questions, but we are able to solicit Q&A in the chat, in the Q&A box here. So we'll watch out right now if any questions come in. But if they don't, we're happy to work with constituents on the call to get your questions addressed. And we'll work with you to post any relevant material to Senator Wyden's website. We have a page for both Bipartisan Infrastructure Law and Inflation Reduction Act resources. So I definitely want to check with you to see what the best resources are to put there. Seeing no questions coming in at the moment, did you want to add anything else for any concluding remarks before we wrap up?
Yeah, I'm happy to speak a little bit more about the program instruction and what we just issued last week on the negotiation programs. That would be helpful.
Sure, I think a little bit on that. And then we do have one question here. Are there any discussions about LEP relief as well? So if you could speak to those things, that would be awesome before we conclude.
Sure. So last week, as I mentioned, CMS released initial guidance to implement the Medicare drug price negotiation program as established by the Inflation Reduction Act. It authorizes Medicare to directly negotiate drug prices for certain high-cost, single-source Part B or Part D drugs, meaning only those drugs for which there is no generic or biosimilar competition. As I mentioned before, by September 1, 2023, CMS will publish 10 Medicare Part D high-expenditure single-source drugs that are selected for negotiation for the first year that negotiation prices are in effect, which is 2026. The maximum fair prices are negotiated for these drugs will be published September 1, 2024, and then they will be in effect beginning January 1, 2026. CMS will also select up to an additional 15 Part D drugs for negotiation for 2027, up to an additional 15 Part B or Part D drugs for 2028, and then up to an additional 20 Part B or Part D drugs for 2029 and subsequent years. The initial guidance is one of a number of steps we laid out in a negotiation timeline that I mentioned that we published on January 11th. This initial program guidance specifies the requirements and procedures for implementing the negotiation program for the first round of negotiations, which will occur during 2023 and 2024 and result in maximum fair prices in 2026. We are seeking public comment on several key elements in the negotiation guidance, and I will walk through those in just a minute. Topics that are not relevant to the negotiation program for 2026, such as renegotiation, are not addressed in the guidance issued, but we will be providing additional information in future related to any program guidance for future years. The guidance describes the approach CMS intends to use in order to select drugs for the negotiation program as required by the law. It describes how CMS intends to identify qualifying single-source drugs. It also talks about what exclusions as provided by the law that we will be making that are for drugs that are not eligible for negotiation, such as certain orphan drugs, certain drugs that have low Medicare expenditures, and plasma-derived biological products. It also talks through how CMS will determine the negotiation eligible drugs by ranking the drugs according to highest total expenditures under the Medicare Part D program, and then exclude certain small biotech drugs as described in the statute. Finally, it explains how CMS plans to rank the negotiation eligible drugs according to total expenditures under Part D and apply any applicable exclusions, and then select the 10 drugs with such highest rankings. The guidance further specifies the approach that CMS intends to use to establish an initial offer as part of the negotiation process to manufacturers to establish a maximum fair price, and how we will consider factors outlined in the law, such as manufacturer-specific data and available evidence about alternative treatments for negotiation. The guidance also describes how in developing an initial offer, CMS intends to focus on the clinical benefit that the drug provides to people with Medicare, as well as whether the drug addresses an unmet medical need and its impact on specific populations compared to its therapeutic alternatives. CMS will not take or accept any offers for the maximum fair price that are above the defined ceiling price that is in the law. In addition to the selection and identification of drugs for negotiation, the guidance also describes the negotiation process that CMS intends to use, including the process for making an initial offer, providing a concise justification to the drug company of a selected drug, the process and requirements for accepting an offer or providing a counter offer by the drug company, and the conclusion of the negotiations, along with the publication of the maximum fair prices in September of 2024. We also describe in the initial guidance requirements for manufacturers of selected drugs, including when they enter into agreements with CMS, how they submit information to CMS, and also the requirement for manufacturers to provide access to the maximum fair price to maximum fair price eligible individuals or Medicare beneficiaries, and to pharmacies and mail order services, as well as other dispensers with respect to maximum fair price eligible individuals or Medicare eligible individuals who are dispensed the drug. The guidance also describes our monitoring and compliance procedures that we intend to focus on, and imposition of any civil monetary penalties for violations. As I mentioned, CMS is seeking comment on certain key elements of the initial guidance for the negotiation program, including what terms and conditions are contained in an agreement between a drug company that they must sign to enter into negotiations. This includes not only the drug company's responsibilities, but also CMS's responsibilities under the agreement. How to consider the drug company's reported data elements and evidence about alternative treatments in the negotiation process, how to approach the offer and counteroffer exchange between CMS and the drug companies, what to include in the explanation of maximum fair prices, how to apply maximum fair prices across different dosage forms and strengths of a selected drug, and how to engage in compliance monitoring and imposition of civil monetary penalties for violation. The initial guidance is open for comment until April 14, 2023, and we will anticipate revising the guidance for this first round of negotiations this summer, in the summer of 2023. CMS is committed to collaborating and engaging with the public on the implementation of the Medicare Drug Price Negotiation Program. The initial guidance release is just one tool among many that CMS will use to ensure interested parties know when and how they can make their voices heard on implementation of the new law. We look forward to receiving comments. And Sydney, did you say that there was a question that came up?
There are 2 questions now. Are there any discussions about LEP relief? And a second question also, how are you going to address patent extensions for expensive medications, for example, Eliquis?
Yeah, I'm not sure what your first question was alluding to, but I can talk to the patent extensions if the person wants to clarify the first question while we're talking through the second. So as part of the drug company's specific elements that are considered for the negotiation process, one of the elements or one of the factors that we will consider as part of negotiation is pending and approved patent applications. And so we will be getting that information in from manufacturers and taking that into consideration as we negotiate maximum fair prices with the drug companies.
Great, thank you. We'll pause for another moment to see if any other questions are coming in. Yes, Alex remarks, late enrollment penalties are a lifetime, which can be a burden as people live longer. That for LEP relief, I imagine. All right, well, seeing no further questions, I think this is a good time to conclude, unless Christy, I really appreciate your time and sharing these resources. Anything else you'd like to share before we sign off?
Yeah, I think a couple of just closing thoughts. You know, there's so many good things that are coming out of the Inflation Reduction Act related to drug reform. And we talked through a couple of them today in a little bit more detail, including the negotiation program, the inflation rebate program, and changes to Medicare Part D. There's more information on the cms.gov website under the Inflation Reduction Act, including some resources such as fact sheets, timelines for implementation. There's also some useful frequently asked questions around the insulin and the vaccine provision that went into effect in January that people might find to be helpful as they're talking about these changes that the law is making to the program and how they're making drugs more affordable. And just really appreciate everybody's time and encourage folks to engage with CMS as we work on implementation.
Awesome. Thank you so much. And thanks for your time and the information. Thanks everyone for listening. We have a break and then we have, 2 more sessions left in the day. One from Department of Commerce that's coming up. And then afterwards, we'll hear about energy tax credits from a finance staffer herself. So we're going to go ahead and pause here. Thank you, Christy. We'll be back online in about 15 to 20 minutes. Thanks, everyone.